My name is Dr. Michael Frederick. I'm a Harvard-trained board-certified plastic surgeon down here in South Florida. And today we're going to be really talking about facelifts because I think that there's a lot of misinformation out there. And so this is the goal of this is to really be educational so that you're really learning what is a deep plane facelift, what's not, what the anatomic differences are. And we're going to do something also really unique. We're actually to describe my pricing structure to you. I think a lot of plastic surgeons are afraid to share their pricing and they don't do so, which leaves a little mysterious. But we're just going to lay it all out there. And one of the reasons I'm doing it is because if you look at the way my pricing is outlined, it's actually structured anatomically. So, the anatomy actually matches the pricing. The more you do, the more you get, the more you need, the more you do. So, I think that it's just going to be really informative and educational, and so I really hope you share it. Just a little about myself. I'm originally from California. I went to UCLA for undergraduate, was studying marine biology, minored in Spanish. I do speak fluent Spanish. Um, and then I went to medical school at the University of California, San Francisco, where we're consistently ranked in the top three medical schools in the country. Although we don't have an undergraduate institution, so a lot of people haven't heard of it. But if you're a doctor, you know what UCSF is. From there, I transferred to Harvard. The Harvard Combined Program is a 6-year program where I did plastic surgery for 6 years there. Harvard accepts 3 people a year, so my year I was one of those three, and then did my entire residency for 6 years again in Boston, and my chief residency at Mass General Hospital, which I like to call my second home. So that was wonderful there. All right. Well, I think that's about it. I think we're just going to start, just really get into it. Okay. So I'm going to start by just sharing my screen here. All right. And there you have it. So essentially, this is my pricing structure and how we do things. And again, it's really anatomic based. So we're going to talk about the weekend lift plus, the facelift. These are all sort of the face procedures, and then the neck procedures, the platysmoplasty, and then the deep plane neck lift. We're going to talk about all that, what that is, and how you can mix and match these things. So the first thing to discuss is the weekend lift. Okay, so the weekend lift is my version of a mini facelift. Okay, but it's not really like a mini facelift as much as it is a deep plane neck lift. Okay, what it is it's more of a miniature incision. Okay, what we're doing is we're making an incision around the earlobe and behind the ear. We're lifting up the skin here, and then around this area here, we're going deep plane. Okay, so we're going to go under the platysma. Okay, so all the dissection out here is under the platysma, releasing the platysma from the from the underlying parotid. Okay, because the parotid holds it there. We need to release that, and then we pull it all back, and then attach it back here to the mastoid process under the bone. So we're getting a nice strong pull. All the skin and looseness here comes with it, and you're going to get a nice, permanent, long-lasting result because we're fixing muscle and fascia to bone. All right, with minimal incision, minimal downtime. Okay. The next iteration of that is what I call the weekend lift plus. Okay, it's just a little bit more. The weekend lift is going to do this. Okay, so it's going to help your jawline a little bit. But if you really have looseness up here, you need that little bit more. And that's so to do that, we need a little bit more of an incision. So we're going to extend the incision a little bit inside the tragus here and along the helical rim, root of the helix, I should say. And what that's going to do is allow me to go under the SMAS here. So the SMAS is continuous with the platysma, okay? It's all one layer. So what we're doing is we're actually going underneath that layer in the deep plane or under the SMAS, okay, to release the ligaments here. And then we're lifting everything up. On the anterior side, we're attaching that to the bone in the periosteum here, the superficial temporal fascia, the bone, and so you're getting a nice, beautiful, permanent fixation here. And then we're doing obviously the fixation back here too. So the Weekend Lift Plus is a deep plane face and neck lift. Okay? And you can get a beautiful result with that and with minimal undermining of the skin. Okay, because we're going deep here again. The only skin undermining is going to be just right around the ear. So if you wear your hair down like this, no one's going to be able to tell that you actually had anything done. The next step up from this, okay, is the facelift. Okay, what I call the facelift. Okay, what it really means is that now we're going to be dissecting out on the face as well. We're going to be doing the weekend lift plus, but we're also going to be doing the dissection out here. So we go along the sideburn to make an incision. We dissect out here in the sub-SMAS plane, okay, because we're going to be releasing the zygomatic cutaneous ligaments, and then we're going to be pulling this up to really affect the nasolabials. So that's really more the full face where we're getting everything. And again, what you need really depends on your anatomy and what your desires are. All right, so that really describes sort of the deep plane laterally. Okay, and what is SMAS, platysma, how it's all one layer. Okay. But what about the anterior neck here? Some people don't need to do anything to the anterior neck. Okay. So their deep plane facelift could mean nothing for the anterior neck. Okay. But some people need something extra. Most people have a little bit of fat here and a little bit of muscle looseness. Okay. For that, I typically recommend the platysmoplasty, where we're going to get rid of the subcutaneous fat. We're going to tighten the muscle here. It's going to improve your angle. And then we cut the bands across here so that we're literally cutting your platysmal bands, okay? And we're creating a sling of muscle here that then we're going to be able to pull in the deep plane here across here to really give you a nice, tight, beautiful result that we're fixating into the bone, okay? And that's the platysmoplasty. Now, if you want to do more on top of that, you can do the deep neck. Okay, this is a deep plane facelift in the neck. All right, this is where we're actually removing the glands. Under the platysma muscle, okay, we have subplatysmal fat, we have more fat, we have the digastric muscle, okay, and we have the gland. If you roll your finger across here, you can feel the gland, okay, and some people have really prominent glands. And if you push in, you can see that without those glands, it'll really improve your jawline. So if you want to look snatched, like I hear about all the time today, this is going to give you that extra result that really you're seeing on social media and all over the place now. But not a lot of surgeons are really doing it. But that's really assessing the deep structures. Okay. So let's just go back to the sheet here. Okay. So you can see there's a gradation of what we're doing. Okay. You can pair any of these with this. And then of course, you can do, just a platysmoplasty by itself or a deep plane neck lift by itself. If, for example, you don't have looseness over here and you don't need to do this. But, if you just need the weekend lift, you can pair that with a platysmoplasty or deep plane neck lift, or both depending on what your anatomy is and what you're desiring. So I did have a patient here that I wanted to go over with you that I think really exemplifies the differences here. So this is a gentleman who really wanted to improve his neck. That was his main focus. All right. And we talked about taking out the glands and the fat underneath the muscle as well. And he just thought that was a little invasive. He didn't want to take out the glands. I said, okay, that's fine. And so we did a platysmoplasty anteriorly, where we took out the subcutaneous fat, tightened the muscle. And then laterally here, we did a deep plane facelift laterally. So we actually did superficial here, deep plane out here. Okay. And we did essentially what we did was the weekend lift plus. All right. So you could see, and that really left his sideburn totally alone because men naturally have a non-hair-bearing skin area here. And if you leave that alone, they just look like they've never had a facelift before when they're fully healed. So it's a really nice procedure to do for men. And you can see how we transected the bands here, took the fat out. His neck looks great. We really pulled that sling up. Okay? But then here he is a month later. Okay? you can see the neck isn't as good as it was before. So what happened? Well, this is a predictable outcome. Okay? We're tightening this up as much as possible, but if you have prominent glands and fat underneath there, you can squeeze it up there as much as you can, but your tissues are going to relax over time and as you heal. Okay. And predictably, the gland came back down. Okay. We didn't get rid of that fat. We just sort of squeezed it up there. Okay. We didn't actually treat it. Well, you can see what a beautiful result he has from here. He looks great. But he really wanted that better jawline. He wanted what he had right after surgery. Well, the only way to truly do that is to get rid of those deep structures. Okay. So we went back into the neck. Okay. And you can see what a beautiful result he has now here. Okay. And because the glands have been removed, he has a beautiful neckline here. So we went from here, platysmoplasty, and then deep face, deep neck. So here he has had, the weekend lift plus, which is a deep plane, lateral lift, and then a deep plane in the neck. And you can see what a nice, beautiful result he has. Also very natural. He's going to have a normal sideburn when this fully heals. It'll look great. He also had an attached earlobe here, um, which he didn't like. So we also fixed that too. So I know a lot of people get pixie ears, and we've talked about pixie ears before. But um, but that is a fixable thing. So if you've had a pixie ear from a prior surgery somewhere else, we're happy to help you treat it here. Here he is from the front. As you can see, he doesn't have major changes in his nasolabial area because we didn't do the dissection out here. We didn't release these ligaments. But we did release all of this, and you can see what a beautiful neckline he has here, and jawline. So that's a final before and after. Um, so I hope that really explains the anatomy, and how, it really depends what you need and what you want and the result that you're going to get. And of course, the sort of a la carte pricing structure really emphasizes that. Um, so we had a couple questions. Violet Flower 8570 says, is the weekend lift only for your younger patients? And I would say sort of. Okay. Certainly, it's for mostly younger patients because mostly younger patients don't need major changes. Okay. But it really depends on your anatomy. Okay. This is the patient who is older, had looseness here, but he had no fat anteriorly here. Now he has a gland. You can see the gland here, but he didn't want to address the gland. It didn't bother him. So he just wanted to really improve the looseness here in the jowling. So what did he get? He got the Weekend Lift Plus. So you can be older and just get the weekend lift or the weekend lift plus, depending on your anatomy. And he has a beautiful result that he's very happy with. He looks natural. He doesn't look done. Okay. He looks like himself, but he's got rid of the problem that he doesn't like. So you can see here from the side, you can tell he still has the gland there. We could make this angle better. But to do that, we'd have to go into the neck, do the platysmoplasty, get rid of the deep structures, and he didn't want to do that. What we did for him was, just a lot less invasive. I mean, we really just did a deep plane lateral neck lift. Okay. And he has a beautiful result that he loves. So, and then another thing we wanted to talk about, another question was a younger patient, Happy Parrot 5191. Okay, they're looking for a deep plane neck lift. Okay. But the patient's like in their 30s. Well, the question is, do you really need a facelift, or a neck lift, when you're that young? And again, it really depends on your anatomy. Oftentimes patients like this who are younger can get away with just doing, something in the anterior neck because they don't have the looseness where they need to cut out the skin. Okay. So this is a patient who I did that on. Okay. You can see the ear's not distorted. She has her natural ear here. We didn't do the weekend lift or remove skin or anything like that. It's just literally removing the deep structures of the neck and the subcutaneous fat, tightening the muscle. And the reason it works is because this line, okay, is shorter than this line. Okay, you can think of it like a triangle. This line is shorter than this line. Because of that, the looseness of the skin gets absorbed by that longer length. Okay, so we don't need to remove it. So this could be a really powerful procedure in a young patient. And, they don't really need a full facelift. They just need to address their anterior neck. So again, everything's sort of a la carte and based off of your anatomy. The next patient I wanted to show is actually my mother. So this is my mom, and the picture above is actually her before and after result with another surgeon. And as you can tell, I was not happy with it. You can see she had the surgery. You can see her ear here. You can tell she had the surgery because her ear is distorted. It's pulled here. She has a pixie ear, whereas before it was flat here. But you really see very little improvement. Okay. The procedure that was done here was a SMAS plication, and I just don't think it has the long-lasting benefits um, that really a deep plane with fixation to, where you're literally separating where you're sub-SMAS and separating it and fixating it up here to the periosteum of the bone. I just don't think you can get as good of a long-lasting result without that. And they also decided not to do any work in the anterior neck, which to me was a mistake. So you can see this is my revision of my own mother. And you can see what a beautiful change has happened here. So we've just adjusted everything, done the proper technique with a dramatically different result. So, um, so again, that's just differences in technique. I just had a few other patients just to put up so you guys have reference here. This patient did what I would say is the more normal thing that I do. These patients did, what I really think of as the full facelift. These patients have had the full facelift with release of the ZMC ligaments, deep plane, lateral neck, lateral SMAS and neck, and then a removal of the subcutaneous fat here and tightening of the muscle. Okay. Here's another patient. You can see the strong platysmal band, and she had fullness here, some fat here, so we removed all that and gave her a nice, beautiful result. And then the last one, this patient is only 2 months post-op, so you can see what a beautiful result she has already, where we're doing all that. We're restoring volume here, lifting it up, giving her a beautiful jawline. Um, and there. So, and she looks great. She loves it. So, I hope that was really educational and sort of describing and making sense of my pricing structure, the anatomic basis for it, and the anatomic basis of the surgery, because it's understanding the anatomy is leads to an understanding of what you really need. All right. Just a couple more questions I get all the time. Do we have a consultation fee? So we don't have a consultation fee because we feel we want people to get educated. And it's really about education. The one thing we do though is we do charge for no-shows. Okay, it's out of respect for my time because whether it's a virtual or inpatient consultation, I set out, a good amount of time to discuss these things with you and to educate you about your face, your anatomy, your body. And if you don't show up, it means we've really wasted a lot of time on the schedule. So that's really why we charge a no-show fee, but we don't charge a consultation fee. Okay. Uh, Lastly, do we do this awake or asleep? So it really depends. Technically everything except for the deep plane neck or removing the glands you can do awake. Um, but usually if you're doing a lot, it's just better to do some twilight. The most that we do is twilight anesthesia. We never intubate anybody. We never paralyze anybody. You're never on the ventilator. Okay. This is just twilight where you're just like a colonoscopy. So if we're doing a good amount, we like to do it under twilight just because it's more comfortable for you. But if you're just doing, for example, the weekend lift or the weekend lift plus, we can do that totally awake, if you desire. So a little bit up to you. Anyway, again, I hope that was really educational and it was really fun chatting with you. All right, see you soon. Oh, one last thing. I wanted to talk about last thing on pricing because this was on the blog. Um, One of my patients who's on the blog, she goes by Serene Quince 2186. She just had essentially the weekend lift plus with me. And there was another patient who had a consultation there. It's all public, so we're not violating HIPAA or anything, but Sonialis basically said that, her deep plane facelift was $40,000, and the other patient said, well, no, I paid like 12 to 15. Okay. Well, let's just share this again and go back to it because when someone throws out a high number and everything, it's sort of mysterious. Well, what does it cost? Well, there's no mystery. It's literally here. That patient did get a quote for $40,000, but it was because she was adding all these different things and we were giving her all these other options. So the bottom line is, if you're doing the weekend lift plus, right, it's going to be this plus this. All right, so $12,500, and that's what it's going to be. And this is a deep plane facelift. Okay, it is. Now, it's not a deep plane neck lift with an anterior neck, but it's a deep plane lateral neck. This is where it gets confusing with the jargon. Okay, so technically, both patients got quoted for a deep plane facelift, but they're getting different things. And so the pricing structure is different. There's no one set price for whatever people want to call a deep plane. Okay. The other patient we discussed, I think really, again, is more, traditional facelift and with platysmoplasty. Okay. And that's $20,000. Now, if she wants to do the anterior neck, we price that out too. Um, because again, if, but most people don't actually need that. So the most sort of that it is if you do this plus this, $28,000. And so, but again, it really depends on your anatomy and what you need. All right. I hope that was helpful and I hope you share. All right. Have a good day. Bye.